Excited to do tonight's IG Live with a dear friend of mine, Joel Cohen. Joel is truly an exceptional person who just is probably one of the more creative people that I know in the specialty. He is a natural kind of curious soul who loves, hey Miles, I got my son in there, who loves to innovate, to make this specialty better, and really that's what we're going to talk about. And so I'm just looking for him, but I'm going to see if I can't get him to come on board here and invite, and we'll go from there. Let's see. All right. There we go. My buddy. I see a connection.
Hey, buddy.
What's
How's it going?
going on, pal?
Things are good here. What about you?
You know what? Just trying to survive in Chicago. We've had a rough start to the week, but things are better.
Well, I wore this hat just for you. I don't know if you can see it, but it's an Angelo's hat.
Well, see, we have to kick it off with giving some background here, and how crazy it is that we connect after, I was lucky enough to know your amazing bride back in the Michigan days. So you're gonna have to tell us. You gotta fill us in on that.
So honestly, it was probably like 2003 or so. You and I were at a meeting somewhere, and we took a picture together, and my wife is like, I know him. And I'm like, come on. And then not only did my wife say I know him, my sister-in-law said I know him. And they both said they were both in residency with you at the same time, correct?
They were exactly.
So my wife did pediatrics and my sister-in-law did pathology, and you were a surgical resident, and they both said the same exact thing today. They said no matter how tough the night was, no matter how long he was up all night, he was always cheerful, and he always was completely poised. And I remember my general surgery internship, and nobody would say that about me. So hats off to you.
You know what? It's like the old saying, fake it till you make it. So I felt like if I put on a clean tie, a clean shirt, I felt better even if we didn't sleep all night. So that was the trick. But no, your Goldie is, both your sister and sister-in-law are two of the kindest people I ever met. And it fits that she went into taking care of kids, because she's an angel.
She takes care of kids. She takes care of my 3 kids, and then she takes care of me. So honestly, according to everybody, I'm the most complicated kid of all.
You know what? It's because, and I don't know if you heard the introduction I gave just before you were logging on, but listen, brother, you're just a naturally curious soul, and that's it. That's why you've come up with, and I'm gonna brag on you a bit, because it's the fun thing of kicking off something like this. But to me, you've come up with so many creative ideas. You've made the practice of aesthetics a better place. And you were one of the people, and this is, how I feel you and I came together, is your view has always been science, 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 and innovation. And it's not about, oh, this is dermatology or it's surgery, but the idea that everything kind of overlaps, and you do some pretty hardcore surgery yourself. And I think that's really what makes everything better,
Thank you. Dude, honestly, I miss seeing you on the weekends. Like, we're together, sometimes 3 weekends a month. And I think this just really shows the collegiality between different specialties at this point, where plastic surgery and facial plastic surgery and oculoplastic surgery and dermatologic surgery have definitely come together when it comes to the injectable meetings for neuromodulators and for fillers and for really understanding facial anatomy. as well as, you know, the lasers that we use on a regular basis and our practices.
I totally, perfectly said. And today I got to play with the new Cyton device, the Moxie and the BBL Hero, which I know you were involved with some of that development, and I got to tell you, I was blown away by what that can do. I'm absolutely blown away.
You know, Cyton as a company is just been incredible in terms of the technology that they've made over the years. You know, first of all, I think having fractional ablative erbium resurfacing that you can use on any skin type for acne scars is really a significant advantage, covering that spectrum of different skin types, and then using it for surgical scars as well. You know, for heavy etched in lines around the mouth, I use erbium, full field erbium resurfacing as well. And sometimes I use fractional CO2, but for the deeper etched lines, you know, full field erbium is the way to go. But the Halo was a really major innovation. Vic Ross and I published the first paper about combining the two wavelengths of non-ablative and ablative fractional resurfacing with erbium. But now, as you indicated, you know, having Moxie at 1927 and that sort of laser family, really being able to minimally downtime, slightly pink, a little bit of dryness, any skin type has been a huge, huge thing for people. And then Hero's exciting, in motion.
In motion. It's almost like out of, I'm definitely a science geek and sci-fi geek. I love like technology. So the idea of a laser that, you know, is so effortless. But so tell me, you know what I think, especially since we have a lot of people, you know, there's some medical people in the audience, but we have, you know, people who are in the general public that are curious. What would you say are the top 1, 2, 3 kind of mistakes that, you know, your average woman who's going into a spa unknowingly to have laser, what quote unquote the easy laser that kind of gets them into trouble?
You know, I think first is, you know, many people go into a facility and they don't ask about the different types of technology. They're just looking really at the price. They're not asking about who's doing the procedure. They're just asking about really the price. And unfortunately, many facilities have IPL devices. And as we know, IPL is a light-based device. It has different wavelengths. However, it really is not the appropriate treatment in many circumstances for people. So, you know, if you have a discrete freckle, you know, we could use a very specific monochromatic, one wavelength, like a Q-switch laser, or you can use a BBL device at 515 filter. But when you're trying to do too much with one device and you're using an IPL, if you have one hammer, everything looks like a nail. And you and I both see, as well as other people, you know, some of the effects of that. We see burns on the surface of the skin from people using and collecting sort of collateral wavelengths in that area, and that type of thing can actually scar, lead to permanent discoloration.
Right, and I think you did hit the nail on the head when, especially if you're in a spa or somebody unknowingly walks into a place where maybe they only have that one laser, that intense pulse light laser, and you know, obviously they're trying to run it as much as they can, and probably are, you know, at times maybe feel pressured to use it, maybe in an indication where they don't want to use it. And I mean, that's, you know, you're a national educator on laser safety and related kind of activity. But, you know, to me, I think that really, really what I've seen, especially and certainly in Chicago, where we've seen a number of spas open. And I'm not saying spas are bad. You know, it's just, I think that there's a range, and like you said, I love that pearl of really asking them what their experience is and who's going to do the laser. So that to me is key. You know, so what? Yeah.
Other types of, you know, issues we see, you know, with lasers specifically are people asking, you know, about downtime. And unfortunately, you know, every day I wish I just had some little volume tune where I could actually apply that to downtime. You want 3 days? Right there, long weekend. You want 5 days? Right there, you know. long weekend shouldering an extra day on each end. But unfortunately, to be effective and to understand that people heal differently, when you do a rhinoplasty or a facelift or breast augmentation, you know, you're always giving a range when people say, how long am I going to have swelling? How long am I going to be uncomfortable? And when we do laser procedures, it's the same type of thing. We really want patients to be on the same page. And if we say, hey, you know, it's going to take about a week of healing time, it doesn't mean have a major social event, your daughter's wedding, on day 8. You know, really, it's important that we understand that range.
Well, and I think that's kind of what's happened in some ways, unfortunately, because, you know, cosmetic medicine is everywhere. My mom, my aunt, I mean, everybody knows about procedures, whereas, you know, you look 20 years ago and it was like this hidden, like whispered thing. Now everybody talks about it. So, you know, when we look at it, Joel, I'm kind of curious, what would you say are kind of the innovations that we should be on the lookout for, at least as it relates to your practice? We can talk about cosmetic, and then we can also talk about, you know, medical, because you do some great medical work too.
Thank you. So, you know, first, I think that there is just an exponential growth right now in the world of devices, and it's exciting to really see what's going on. And, you know, from a perspective of, I do Mohs surgery and skin cancer surgery 2 days a week. It's not as big as the facelifts and the, you know, the big procedures that you're doing, but, you know, often they're a large flap, a cervical facial flap, or other types of procedures, or bilobe flap on the nose, or, you know, so, you know, when we meet with people, I think, you know, one of the important thing is that when you're doing a facelift or another types of facial procedure, or I'm doing a Mohs reconstruction, we tell people, you know, we have lasers that can actually help the scar look better if that's a concern. It's not always a concern. And I think that, you know, having that in our back pocket is really helpful. And I think the technology is getting better and better about treating scars, and treating scars more effectively, and treating scars in different skin types. And I think people need to have realistic expectations. When you cut the surface of the skin, there's going to be discoloration, there's going to be some swelling, and you may actually heal with different patterns. You know, for some of the fair complected people, we see all these new blood vessels that form, what we call that neovascular blush. And that's not something wrong. It's just something that we expect, and you probably tell our patients. But we have great technology to treat it, like a pulse dye laser.
Yeah, and that, I think that really, that's a really important point. It's one, like even today I was doing, you know, you mentioned facelift. That's literally what I was doing just before this, which I'm so glad I finished with plenty of time. I was not rushing. If any of the friends of this patient are watching this, it went silky smooth. But, you know, to me, it's one of these things where being able to combine technology, and, you know, in particular, she's going to come back tomorrow because the surgery center where I do the facelifts, they don't have access to the Halo platform. So she's going to, when she comes back tomorrow for her check-in, I'm planning to halo her face, and that's a treatment that, you know, you have experience, I have experience. I mean, you know, it's a full face, 6 minutes, and you're done. Whereas before, the old, like, you know, coherent laser days, CO2, you know, to do a laser of the face was an hour, and people were like burn victims, and I mean, it was this horrible thing. And so I think being able to combine multimodality therapies, it's where things should be.
You know, I agree with you. It's great when you can have patients who have a bigger procedure come back to you and check on them. And it's even better if you can actually ensure that they're going to come back to you for check on them and do another procedure that day. So in my smaller procedure type of world, you know, where I'm not doing facelifts, where I may actually do full face resurfacing for somebody, you know, when they do come back, you know, it might actually be beneficial for me to actually look at them and do like hand augmentation with fillers. So that just allows me to do a different procedure, different region, check on them, and do something else so that I can make sure that they're actually looking okay and taking care of things okay. Another type of thing that, you know, we do for the people that don't do resurfacing on the neck, you know, when they come back at follow-up, we can do some sort of radiofrequency procedure or therapy procedure at that follow-up visit on a different region. Still, again, checking the face, but allowing them to come in and making sure everything's okay.
So how often, I'm curious about you, because this is on the front of my, really at the front of my mind, right now or today in particular. How often do you get crazy requests?
Honestly, we get requests all the time, and the more we hear, and I'm sure you do, the more mainstream it actually is. So honestly, today I had a request for a 16-year-old girl with mom's permission who wanted some lip augmentation. And if you truly look at the picture, she really had very, very thin lips. And I don't foresee a problem putting in a very small volume, and mom's signing consent, mom's on board. And I think Ken Arndt really wrote an important article a while back where he talked about prejuvenation, and most of it was about using neuromodulators like Botox and Dysport to sort of prevent etched in lines when people are young in their 20s. But very often you see somebody who may be old enough to make their own decisions.
Right.
This person's old enough to drive, so old enough to actually have some level of responsibility. And if there's something that bothers them, and we can fix it, that's fine. I honestly, from a similar perspective, I do earlobe repairs like you do earlobe repairs.
Right.
And sometimes there's somebody who had their earlobes pierced. They wore some loop, earring. Somebody got snagged on it. It got pulled, and we do an earlobe repair. So if she wants a little bit of filler in the lip, I'm okay with that.
I think that's a great example. I didn't even see that as, an unusual or unfair request. It may have been thought to be kind of an unusual request, 15 years ago, but now, I mean, especially with safety and the technology, I totally agree. And I had a case like that, very similar actually. I mean, she was 18, but a really gummy smile. She was very, very self-conscious about it. And with a little Botox, a little bit of, actually we used Xeomin, and a little bit of filler, it totally changed. She was kind of shy about things a little bit, and now all of a sudden it's like boom, she's at a much better place. So I totally agree with that. Totally agree with that.
So what about you? What type of requests, even surgically, do you get?
I've been getting requests that are, it's really interesting. I think because, people have a lot more time on their hands. They're looking at, themselves on video through Zoom or FaceTime and all these other things. And so literally I will have men and women, I'm not going to pick on women alone, but men and women who literally will say, when I tip my head down, I have all this stuff, and I think it's just gonna, one day it's just gonna stay there. And so can you just go in and just do a facelift now? Because I'm 33 and I don't want to, I mean, I'm not even joking. I had a virtual consult with someone in Texas who, I'm not going to say what city in Texas, but in Texas, who basically had it in their mind that they wanted to get a facelift at 32. And what they were saying was, well, I read this thing online where somebody said you don't want to wait any longer than 40 to have your first facelift. And I was listening to this and I was thinking, am I in the twilight zone? There is no way that a 32-year-old and normal surgery, I'm not talking about medical. Hey, Grace, I'm talking about just straight up pure cosmetic. And you would look at her and you say, first of all, A, this woman is beautiful. And B, there's no way you'd put a scar on her. But she was hell bent. And the scary thing is, she may find somebody to do it.
So in addition to the exact indicator in terms of the number it takes, days it takes to heal that I always wish I had, I honestly, we all wish we had a crystal ball and knew exactly what somebody's outcome is going to be. And then we all wish that we had like sort of realistic expectations from everybody. And I think people don't realize that we're a co-participant in their care and they're a co-participant in their care. So, when people have these procedures done, we really need to make sure they're doing great wound care. They need to really want to do great wound care. If they have sutures, they don't want to be pulling the tape and pulling apart things. That's so important. And, for some of these procedures we do in certain areas, where, we may talk about cellulite or something, but we did a clinical trial and you did it as well. And there weren't any specific stipulations about what people can do afterwards. And swelling and more bruising.
Joel, you were breaking up a little bit for a second. Sorry. Okay. So yeah, I mean, to me, and you're
No
right.
worries.
You brought up can you hear me, bud? Can you hear me? So we
Yes.
have a question. What do we do to, expedite healing? If somebody's having a procedure, what can we do, or recommend? And, to me, Joel, are you there? I just see you're spinning a little bit, the connection there. All right. Well, I'm going to answer that question while we're waiting for Joel to. It looks like you may have an internet connectivity issue. Yeah. Is it mine? Mine shows. I'm in my office. I've got a full signal here. Um, but in any case, the question that let's see here. Let's see. Uh, okay. So anyway, yeah, it's still a little glitchy on your side, bud. Uh, but so I'm just gonna answer a question, and then as soon as you come back on, we'll jump back in. But question about dark circles, and there we go. You're coming back in, and bags under the eyes. I just did an interview about this, but generally speaking, dark circles, bags, or puffiness under the eyes, it's a really frustrating thing. And in general, it boils down to like skin related kind of change, and in particular pigmentation in the skin itself, combined with prominent blood vessels under the skin. And certainly in skin of color, especially individuals from a West Indies background, that's a very prevalent or common finding that I see. And basically, in terms of the ultimate kind of issue, one of the tricks we can use is laser, which Joel and I were talking about a little bit. One of the other areas that we can make a difference is by using filler. And actually, a number of the kind of hyaluronic acid based fillers are really effective, especially in skin that has a little bit of pigment in it. You can place the filler in a way to kind of shadow some of the darkening, but also you can help fill in a groove that creates the shadow as well. So that's the couple of very specific tricks that are non-surgical. Obviously, there's the surgical option, which that's an area of special interest for me, is blepharoplasty or eyelid lifting surgery. So that's kind of the final stop, which I ended up doing actually earlier today. So Joel, did I get you back? So no, that's okay. That's okay. Listen, I've got two boys, and they're older now, but it's still. Well, that's right. Yeah, happy anniversary. You there was another question about kind of pro healing or helping the healing process in terms of after a procedure, after laser in particular. So I Yeah, you know, I think your internet is being robbed by a 7-year-old.
No.
Okay, now it's better. It's better now. Okay. Um, you know, we're locking. We got about 5 more minutes, but it's glitching a little bit. Um, well, I will. Hey, Jimmy. Um, you know, I think that there are a ton of nice pearls that have already come out. I am gonna like chime in on my thoughts about aiding healing. I think it begins that can ultimately deliver a treatment that will allow for ultimately a rapid recovery. And what does that mean? So if we're talking about laser, because laser is very much on my mind with this new device, the Jewel device from Cyton, that I was lucky enough. We were, I think, the 4th clinic to get to use it in the world, is what they had said. This is really, in my mind, it encapsulates the goal of, of new technology, and that means delivering a controlled injury, which is what laser does. Laser is selective towards pigment, and pigment can be blood cells, pigment in the skin, or a combination of both. And the key is knowing how to deliver that energy in a way that creates a what we would call a sublethal effect, meaning it's not destroying in a permanent way, but rather creating just enough of a wound to get your desired effect. It may be getting rid of a series of pigmented spots on the skin, or it may be getting rid of fine lines and wrinkles or acne scarring. But you're creating enough of a wound that the body then comes in and takes over. And that's really what Joel and I and our colleagues do is we've tried to figure out a way to create controlled injury, and in exchange looking forward to an improved appearance or outcome. And the newer technology allows for really helping to guide and control what that, I'm bringing Joel back on. It helps to really control what that level of injury is, and especially for kind of experienced providers. There he is. He went outside. Now you just had to show off that you're in Colorado. Um, but in any case, you know, if you put all the pieces together, you know, a device that actually can cool the skin but yet let it superheat is the best of all worlds. And that, I'd say, is the number one step. Number two is really being healthy, hydration, good nutrition. There are all kinds of supplements. I'm a big fan of arnica, and as well topical care. So there are a couple of antioxidant topical agents that I like to use after a laser treatment that seems to speed up the recovery as well. So there was a question, Joel, and we have a few more minutes. What do you like to do, you know, whether it's naturopathic or the like, to really speed up the healing process for your patients, whether it be surgery or laser or some combination?
Yeah. Well, first, I think it's absolutely critical that they follow the doctor's recommendations. I think, you know, people really need to pay attention to wound care. And in an ideal world, I really like when patients bring a family member or friend with them so that they can actually have an extra set of eyes and ears to listen to and to see what the wound care instructions are. So for many of my procedures, like, you know, heavy laser resurfacing or for a flap or graft on the face, it's really important that people get things right. And, you know, secondly, they need to think about potential contamination areas. So, you know, when people are wearing masks all the time, we certainly don't want them to wear, you know, the same mask where it's going to have makeup and nasal secretions and oral secretions, and they put that on after a surgery or they put that on after resurfacing. So a clean mask is really important. And then being at home so that they actually don't have to wear a mask at all for a while during the healing process. And then, you know, I do use arnica for patients who have cosmetic procedures, and I think it helps with people who have swelling. I think, you know, for people who are prone to a lot of bruising, low dose bromelain, like pineapple juice and not supplement dose, can be helpful. Topical vitamin K. And then, you know, just paying attention to the little nuances of things. we use hypofix tape all the time in practice to really establish a pressure dressing. When people go to use that at home and they rip the bandage off, they're stronger than the stitches. They're going to rip the stitches out too.
Right. No, absolutely. Absolutely. And so we'll run over a few minutes just because of the connectivity issue. So tell me, if you had to kind of look at really your favorite combination therapy for someone, and I'll answer it. I'm going to make you answer first so I can think about my answer. But if you had to pick your favorite cosmetic combination, it could be light and energy base, fillers, Botox, you name it. But if you had a person who, let's just say, dark circles under the eyes, that was a question that we had. What would be your combination approach, and what order? What would that look like for your typical kind of dark circle under eye patient?
I think dark circles are a really challenging type of issue to treat. There was a metastatic article I did with a few other people, including Brian Weisman, who I know was on your show and is a good friend for both of us. So the article, we really reviewed the different causes. For some people, it's volume loss. And when we simply put filler underneath and replace that volume, it's taking advantage of the fact that there's no longer a shadow anymore. And then secondly, it's pulling the skin further away from the underlying issues like blood vessels that are quite apparent. If people still have persistent, prominent blood vessels, then you can use like a long pulse ND-YAG laser. I published on that. And that's something that's actually really effective. We do need to use it carefully, and we put in internal eye shields for that, not external. And then, from a other perspective, just being a dermatologist, we see a lot of people who are allergy prone, people who are rubbers and create a lot of friction. And I rub my eyes a lot. And I think we need to recognize that. We need to stop the rubbing, and we need to be able to treat some of that thickening of the skin we call lichenification.
Awesome. Now that I like the last pearl. That was especially that was perfect. For me, my favorite combination is using, and I love my threads or the Instalift, but using suture suspension combined with volume restoration. So if I have somebody who's in their mid 40s, late 40s, early 50s, who says, I have some jowling and whatnot, and I really, I don't want to have a facelift. What can I do? I'd love to suture suspend or lift that area, and then put filler into the kind of the crease that's often created, which is the marionette fold, right in front of where the jowl would be, and then build up back along here. And then my trifecta is actually using off-label Kybella. I'm curious about your thoughts, but Kybella to shrink kind of jowl fat, especially for those who tend to be jowly, in this area, even at an early age. And I found that combination has revolutionized at least my non-surgical practice. So what about you? Are you a fan of Kybella off-label for jowls or facial fat?
If I draw like a circle around the antigonial notch, and then make sure I'm like a centimeter away from where I anticipate the marginal mandibular nerve is, I think that I have a lot of success using that. But for some patients, as you indicated, they need a combination of different things. And putting filler in the marionette area and the pre-jowl sulcus, doing things posteriorly can be really helpful. But I really like laser resurfacing for people, not only for lines and wrinkles, but just that tissue contraction. And at the same time, I very frequently will do radio frequency, like the Genius RF, where there's a lot of different devices. And the insulated needles are actually safer for all skin types. So, in that perspective, doing that the same day as the resurfacing can be really helpful. And then, going back with another technology, different mechanism of action like therapy, just to tweak it a little bit and to get a little bit more contraction from a different mechanism of action.
Love. So you're really, and that's the theme, I think, for our kind of discussion is really targeted therapy. You're using science to target the area. So really what I'm hearing is you're superheating kind of the outside and the inside at the same time. It creates this synergy so you can get this, fairly dramatic effect. And then you can come back and you can stack more energy on it. And so you get this, it's really like this customized, you know, minimally invasive or non-invasive rejuvenation that honestly, I think, like I said, 15 years ago, you know, 18 years ago, almost 20 years ago when we met, I would have never even thought this was possible. So I'm excited. What do you, last thought for both of us here, and then we'll say goodnight. But because you got an anniversary to get to. But if you had to predict the next great thing coming out, I don't want you to break any confidentiality things, I won't either, but the next great thing in aesthetics as a concept, what would that be?
You know, I think that we are having sort of a major innovation in energy-based devices for various types of things. And I think we're going to see very soon lasers specifically for acne that destroy sebaceous glands. I think we're going to see energy-based devices would have electromagnetic pulses that can destroy benign lesions like seborrheic keratoses and things like that from Pulse Biosciences. And then we're seeing these fractional resection devices from Recros and Citrellis, where people can have areas resected from their skin for laxity and have a quick recovery and be able to go back and have a series of treatments without ever having a big surgical procedure. But for you, you know, for patients who come in, you know, if anybody where they start pulling and they do something like this, immediately I just said, I'm not the guy for you. I need to send you to a plastic surgeon. You can go to Chicago or New York and see Julius Few, or I'll give you some other names. But as soon as people start with this, you know, the reality is the energy-based devices cannot deliver what you can surgically.
See, this is why we've been, not just because you would send them to me, but because you stole my line. I predicted also, and I would agree, that's why we're buddies, that, you know, ultimately the future is going to be light and energy based that really helps to treat skin laxity. I mean, that's the holy grail. I mean, I every day I have somebody who says, you know, my arms, I don't like the skin laxity, or my legs, or what have you, or my belly even, you know. And so to me, I mean, there are cases where you don't want to have to cut on them. And I think technology, I believe, like you, we're gonna see some interesting things on the horizon. Well, listen, I do not want Goldie killing us. You get the last word, but please send my love to her and your beautiful kids. And really appreciate you making time, especially on such a big day for you.
Well, thank you for having me. It's always been fun to hang out with you, and I had a good time here as well. And my wife says hello. My sister-in-law says hello to you. Fond memories of residency at University of Michigan. And my reference to Angelo's, specifically for Julius's, Angelo's is a restaurant directly across the street from University of Michigan Hospital. It has one of the best breakfasts in the world, and they're famous for their cinnamon French toast. You can go there and have anything. It's amazing.
I
The
live
cinnamon
there.
French toast is incredible. So we go and we actually try to do what I call a Michigan trifecta or quadrifecta, where we go to Michigan football, Michigan hockey, Zingerman's, and Angelo's same weekend.
You got to do Zingerman's too. Zingerman's helped us survive internship. So, well, listen, buddy, best wishes to you. This was awesome. And we'll do it again.
Good talking to you.
All right,
Thanks,
buddy.
Julius.
You take care.
Have a good night.
Bye-bye.
Bye-bye.
Even with a